Hi everyone, my name is Valentina Zapata and my topic is early or delayed cardioversion in recent onset atrial fibrillation. First, definition. Atrial fibrillation is a condition of irregular rapid heart rate that occurs when the two upper chambers of the heart experience chaotic electrical signals. Immediate restoring of sinus rhythm using cardioversion is commonly preferred, but if immediate cardioversion is necessary or not is not known.
Dr. Hannah, what's your feeling about cardioversion and nodal ablation?
Cardioversion, I think that if you have somebody with paroxysmal atrial fibrillation, everybody, gets a chance at trying to achieve sinus rhythm. I think that some patients with cardiac amyloidosis, no matter what you do, you can't just keep them in rhythm. You're getting cardioverted every couple weeks. The one thing I would say about cardioversion, there was a publication showing increased risk of thromboembolism. And the fact is that even in sinus rhythm, patients who have a lot of amyloid filtration in their atria can have such poor atrial function that, for example, on mitral inflow, you barely see even an A wave. There's been documented that you can have atrial thrombus in normal sinus rhythm, or for example, when they're in AFib and you have them adequately anticoagulated for a period of months, well above what you would consider needed, that you wouldn't need a TE anymore. We're now recommending that patients get TE even if they're adequately anticoagulated, because there's a percentage will still have persistent atrial thrombus. It's just, the CHADS-VAS score, the CHAD score does not account for the very high risk of atrial thromboembolism that you see in cardiac amyloidosis. As far as, did you say ablation?
Yeah.
Yeah. So as far as ablation, atrial fibrillation, we actually looked at that at our institution at atrial fibrillation ablation. The kind of the consensus before we started doing that was, look, the likelihood of this being successful is very low. There's a lot of amyloid, there's a lot of scarring. And so we're going to be putting people through a procedure that's likely not going to work. And one of our EP fellows actually looked at our patients who underwent atrial fibrillation and then propensity matched in 3-to-1 with propensity matched patients with AFib who did not get atrial fibrillation, and actually showed that they had significant reduction in atrial fibrillation burden and actually a mortality benefit. Now that's a very hypothesis generating publication study, but I think in my typical elderly patients who had long-standing AFib, and they're very advanced, I don't feel that in general I wouldn't pursue an atrial fibrillation ablation. I think if somebody who has paroxysmal AFib or and really doesn't tolerate AFib well, I think it's not completely unreasonable to consider an atrial fibrillation or pulmonary vein isolation.
Applications in medicine. Atrial fibrillation is one of the most common arrhythmias, affecting around 2.3 million adults. Men, especially those of white ethnicity, are more likely to develop atrial fibrillation than women and individuals of black ethnicity. The prevalence increases with age, and almost 10% of people greater than 80 years are affected. The most common causes of atrial fibrillation are hypertension, coronary heart disease, cardiomyopathy.
Hi everybody, and thank you for joining me in this new short video presentation from ARIA EP Talk series. I hope you will enjoy it and join me in my future video presentations. Our patient is a 49-year-old man who was admitted for the first time in August 2020 in another center with new onset heart failure and atrial fibrillation. At that time, an echocardiography showed an ejection fraction of 25%. Coronary angiography was normal. Several days ago, he was referred to our center for further evaluation. In the next slide, we will see together the MRI images of our patient. In MRI, there was no evidence of myocarditis. Left ventricular ejection fraction was 40%, and it was interesting to see diffuse late gadolinium enhancement in right and left atrium, especially in the right atrium, which is compatible with the diagnosis of isolated atrial amyloidosis. Atrial natriuretic peptide, or ANP, whose amyloid is responsible for isolated atrial amyloidosis, is known to play an important role in the pathophysiology of congestive heart failure and atrial fibrillation. Long-standing atrial fibrillation has been associated with intraatrial ANP amyloid deposition, suggesting that AF-related ANP overproduction leads to localized amyloidosis, which in turn augments conduction heterogeneity, helping to perpetuate atrial fibrillation and thereby stimulating further ANP production. Last but not least, I would like to introduce this study in which the myocardium of the right and left atrial appendages in 64 patients with paroxysmal, persistent, and permanent forms of atrial fibrillation were examined by histological methods and electron microscopy. Based on type of AF, isolated atrial amyloidosis was detected in 50 to 56% of the patients in the left atrial appendage and in 45 to 55% of the patients in the right atrial appendage. In all cases, immunohistochemistry revealed atrial natriuretic peptide in fibrillary amyloid deposits. I hope you enjoyed this short video presentation, and I would like to invite you joining me in my future short video presentations. Thank you.
Pros and cons. Pros. Spontaneous conversion and delayed cardioversion reduce the need for immediate pharmacologic or electrical cardioversion. Early cardioversion shortens the time until conversion. A potential advantage of shortening the time until conversion will be earlier elimination of symptoms and prevention of heart failure, syncope, cardiac, or cerebral ischemic events, or progressing to persistent atrial fibrillation. Cons. Delay cardioversion with longer time spent in atrial fibrillation could promote stroke, but timely, guideline-based initiation of anticoagulation is expected to reduce the risk of stroke. Issue apply in Ecuador. Prevalence of AF in older Americans living in rural Ecuador is low, both racially determined short stature and frequent dietary oil fish intake may explain the low prevalence of AF in this rural setting. According to data collected by the National Institute of Statistics and Census of Ecuador, INEC, in 2014, a total of 4,430 deaths from AF were reported. Conclusion. Atrial fibrillation is an irregular altered rhythm which can be episodic or continuous. Paroxysms or tachycardia may occur. To prevent atrial fibrillation, it is important to have a healthy lifestyle to reduce the risk of heart disease. A healthy lifestyle can include following a healthy diet for the heart, increasing physical activity, avoiding smoking.
An arrhythmia is a problem with the speed or rhythm of the heartbeat. Atrial fibrillation, AF, is the most common type of arrhythmia. The cause is a disorder in the heart's electrical system. Often, people who have AF may not even feel symptoms. But you may feel palpitations, an abnormal rapid heartbeat, shortness of breath, weakness or difficulty exercising, chest pain, dizziness or fainting, fatigue, and confusion. AF can lead to an increased risk of stroke. In many patients, it can also cause chest pain, heart attack, or heart failure. Doctors diagnose AF using family and medical history, a physical exam, and a test called an electrocardiogram, EKG, which looks at the electrical waves your heart makes. Treatments include medicines and procedures to restore normal rhythm.
Thank you for your attention.